welcome to our virtual learning session with NACCHO360 PHI 2026. Today, we'll be talking about leveraging real-time overdose mortality data to drive community action and transparency. So we'll keep us going here to introduce where we're headed today. My name is Elizabeth Bobo, and I'm the Senior Public Health Strategy Consultant with Conduent Healthy Communities Institute. I'm the account manager for Franklin County Public Health's HCI platform, and I work closely with Logan Legg. Logan is an epidemiologist with Franklin County Public Health, and she'll be leading most of the presentation today. So I'll pass it to her to dive deeper into our presentation on the next slide. Logan, when you're ready.
Thanks, Elizabeth. So today we'll touch base on the background of the overdose issues in Franklin County, our main problem of not having timely data that was able to be shared with the public, how Franklin County Cares became our main solution to sharing timely data, and some of our plans moving forward. So Franklin County Cares stands for Franklin County's Comprehensive Addiction and Recovery Evaluation System. And before we got started, I just wanted to kind of show a quick glimpse of what the Franklin County Cares homepage looks like. And you can see right on our homepage, we highlight all of our overdose related data, and we'll dive more into these as we move through our presentation. And we'll start off with a little bit about Franklin County Public Health. So Franklin County Public Health is in Franklin County, Ohio, which is Central Ohio. We have about 150 staff members. We serve 15 cities, 17 townships, and 8 villages. Which is really all of Franklin County, except for the city of Columbus and Worthington. And the map on your screen shows our jurisdiction highlighted in that light blue-gray shading. Franklin County has a population of just over 1.3 million residents. FCPH provides services to about 41% of these residents. And then as we talk more about the data, it's really important to provide a little bit of a demographic background into the county. So 49% of Franklin County residents are male, 57% are non-Hispanic white, and 23% of our residents are non-Hispanic Black. So between 2016 and 2017, overdose deaths in Franklin County increased 37%. We continue to see this increase into 2018 and 2019, not only in Franklin County, but in Ohio and nationally. And so in 2019, Franklin County Public Health received the Overdose Data to Action grant from the CDC. And this grant, lovingly called OD2A, helped Franklin County create new partnerships as well as enhance our existing partnerships with nearly 20 community and local government organizations within our county. And during this first cycle of OD2A, FCPH and our partners implemented new data collection, prevention techniques, peer support programs, as well as harm reduction strategies to help address overdose and substance use in our community. The work of FCPH and its partners helped community members learn more about the opioid epidemic, as well as become more aware about resources to help reduce deaths and find help. And then in 2023, Franklin County was one of 40 city, county, and territorial health departments to receive the Overdose Data to Action Limiting Overdose Through Collaborative Actions in Localities grant, also known as OD2A Local. This grant has allowed us to continue our work from the first iteration, but we also were able to start a new drug paraphernalia testing program where community members can provide samples to help better understand the drug market, as well as build a surveillance system around understanding linkages and retention and care for substance use. So we'll start with a little bit of the background of what the overdose epidemic has looked like in Franklin County. Overdose deaths peaked in 2020 with 803 residents dying from unintentional overdoses, which gave us an age-adjusted mortality rate of 60 deaths for every 100,000 residents. In 2025, that number has decreased to 325 overdose deaths among Franklin County residents, or an age-adjusted mortality rate of 24 deaths for every 100,000 residents. Compared nationally, in 2020, the overdose death rate was 28.3 deaths per 100,000 residents. So you can see we're nearly over double that back in 2020. And in 2024, because 2025 still isn't available, the national age-adjusted mortality rate is 23 deaths per 100,000 residents. So we are more aligned now with the national trends as we've seen those decreases. But despite these decreases,
no, that's a huge change.
Yeah, huge decrease in the last 5 years.
Yeah, get more aligned. Thanks for sharing the national comparison too. Sorry.
Yes. And so despite these decreases, unintentional injuries were still the third leading cause of death in Franklin County in 2024, and 49% of unintentional injury deaths were overdoses. So even though we have seen this significant decrease in overdoses in the county in the past few years, these decreases are not proportional across all of our demographic groups. Black Franklin County residents continued to see increases in overdose mortality rates between 2020 and 2022, while during the same time period, white residents actually experienced a 25% decrease in overdose mortality rates. And additionally, between 2024 and 2025, we saw a much smaller decrease in deaths among our Black residents, which was about 13% compared to a 41% decrease among our white residents. And additionally, the percentage of overdose deaths involving a stimulant like cocaine or methamphetamine has been increasing, with cocaine being involved in 57% of overdose deaths in 2025. So as we saw, overdose deaths and hospitalizations were rapidly rising, and Franklin County Public Health knew we needed to be able to receive and share timely data with community organizations and the public. FCPH also knew that overdose rates varied by zip code, as shown in this figure on the slide, and knew that this information would be vital for partners to inform outreach activities. However, finalized mortality data from the state could take up to and sometimes over a year to be considered finalized, and that was leading to a large lag in our data sharing abilities. So at the same time, the first iteration of OD2A had a strategy that was focused on creating an innovative surveillance system. And FCPH knew that we wanted this system to have a focus on linking overdose data with risk or protective factor data. We also knew that local data had to inform how to respond to the overdose epidemic, and that the system needed to be able to highlight local data. As you see in the graphics, the goals of implementing CARES is really to have a process of where we would collect and analyze local data, and then visualize, publish this data on CARES, and then use that data to inform our response activities, which would then be implemented, and then we would redo the cycle again to allow us to continue our tailored activities based on trends being seen. And because of that, as we looked into platforms, HCI was able to meet this request, which is how we ended up landing with them to help build our Franklin County Care site.
Yeah, it's great to see the cyclical kind of nature of iterating and reiterating what we're learning and sharing. And we are excited to have been part of that, the visualization, publishing, and really making things more transparent, and so that the community can inform and implement response activities. So I'll give us a little background on Conduent Healthy Communities Institute, or HCI, as we've been saying. So overall, we provide end-to-end solutions that link health and social determinants of health data with technology and public health expertise. So in practice, these tools support health departments, health systems, community collaboratives, a variety of organizations across the country to bring their data-driven impact on community health improvement to the next level. Like we talked about, that transparency component is a really big thing to make these activities more useful to community members and programmatic folks alike. So our team of multidisciplinary public health experts, in partnership with our clients, has an impact on over 90 million lives, as you can see in the top left corner, across the country. We're in over 31 states and U.S. states and territories with the HCI platform. And we have over 18 years of experience doing this with public health partners. And that is really making the most of health data through strategic support services and our web-based software as a service, the HCI platform. We also have completed over 400 community health assessments and plans through our consulting services wing of HCI. So the HCI platform, as we're talking about here with Logan, is a customizable online platform that provides robust tools for analytical insights into a community's health and overall well-being status. And this platform offers just that centralized place for data, big focus on transparency, but ranging on a variety of topics from disease and mortality rates to education and civic engagement, knowing that a lot of different factors can affect a community's well-being and health status. Indicators on the platform are maintained and automatically updated by our data team, but we also have different capabilities for adding in locally maintained data, as we'll see shortly with Franklin County, and how they've really taken advantage of this feature to hone in on the OD2A more timely data sharing. And to further build out the story of a community's well-being, the HCI platform also offers evidence-based best practices, funding opportunities, and tools to communicate your own story and community health initiatives to more transparently measure and track and show the impact of programs with these powerful tracking tools. So, based on what you've heard from Logan so far, it might make sense how the HCI platform was a good fit to meet their needs and increase engagement in their overdose to action or OD2A work. And based on that, in early 2022, I worked closely with the FCPH team to launch the Franklin County Comprehensive Addiction and Recovery Evaluation System, or CARES for short, as we mentioned earlier. And then later on, we'll actually take a look a little further into how they've made the most of the HCI platform's tools, while also being able to incorporate previously developed tracking systems to increase overall transparency, as we keep mentioning, that engagement and understanding of really how the opioid overdose and misuse crisis is affecting Franklin County. Now I'll pass it back to Logan to get back into the weeds of what we're looking at.
Yes, so as we mentioned before, there wasn't a localized data system available. We were relying on state mortality data that had a significant lag in being finalized, yet overdose deaths were consistently increasing, hospitalizations were increasing. And so we wanted to be able to update data on a more regular basis, ideally quarterly, but as this timeline shows, sometimes data wouldn't be finalized for over a year. So overdose deaths occurring January through June of 2023 weren't finalized until September 30th of 2024, meaning it was an 18-month wait for quarter one 2023 data to be finalized. And so we started looking at our partners locally to see how maybe we could address that gap.
And this is definitely something we see with all data, but even more important to have that ability to respond more directly and in action is huge for overdose data for sure. So excited to see what we did.
Yeah, so as we kind of mentioned with this delayed data, it was harder to identify trends and emerging issues in a timely manner to share with partners. But then there's no easily accessible way for partners to be able to visualize local data to better inform their work. We know visualizations and maps are a lot easier for people to comprehend compared to a list of tables. So we wanted to really make sure there was a priority on that when we started sharing our own data. And so that brings us back to CARES, where our goal was to highlight that local data. And our initial building stages of CARES allowed for new and improved data sharing partnerships to form between organizations that were previously siloed. So we were able to start a better data sharing relationship with our Franklin County Coroner's Office, with the Franklin County Sheriff's Office, the Columbus Fire Department, and even the Supreme Court of Ohio. They all started sharing data that went into building our dashboards on our site that live on the homepage. And so this data is shared by partners to FCPH, and then me and my team spent a lot of time developing SAS code to process and clean this data. And then once this data is cleaned, it's uploaded into a Tableau dashboard, which is then embedded on our CARES site.
I think this is awesome to see those different kinds of partnerships. We don't always have that overlap in public health. You got some big hitters in there. So
yeah, we were able to bring people from all locations of the county to the table. So that was very helpful.
Yeah, awesome.
And so since the launch of CARES, our data sharing has continued to grow and improve. So in that last slide, I had 4 partners. Currently, we have data from 7 partners represented and being displayed on the CARES website. And I think one of our biggest successes in this data sharing comes from the Franklin County Coroner's Office. And so in 2025, the Franklin County Coroner's Office began sharing closed overdose death cases monthly with me and my team. So that means all overdose deaths that happened in February are closed and finalized and sent to us in March. So we're having a lot quicker turnaround of overdose death cases. And we've been able to then incorporate this updated data into a new Tableau dashboard that's embedded on CARES. And we just, of course, list it as preliminary, but it's been really useful for partners to be able to see more recent data than waiting for a full year to be completed. So in addition to the updated mortality data, CARES highlights several other substance use and overdose related data, and we have 7 partners, as I've mentioned. So we utilize the Ohio Syndromic Surveillance System, which is Epicenter, to monitor emergency department visits for overdoses. The Supreme Court of Ohio has continued to share court docket related to diversion programs. And then in 2025, we also created a linkage and retention and care dashboard that displays individuals who have been identified as having substance use disorder, and if they were engaged by overdose prevention staff, referred to treatment, and then if they were referred, if they actually initiated treatment. And this includes individuals who were identified after having a non-fatal overdose or were involved in the criminal justice system, or were just identified when they were presenting to a clinic for treatment.
This is phenomenal to have these kind of data that quickly available. So we really see, I mean, it shows in the numbers with a lot of different efforts to address and prevent those preventable deaths. So now I'm already talking. Let's take it over into a little bit of a live tour. So you can see some of these key tools on CARES. I'll take you into the actual site where we'll start off with the demographics dashboard. So here, you also have a screenshot in the slides, but this is it in action. And oops, nope, it's not. Come back. All right, I will quickly end the slideshow. And now we can see it. All right. So here you can see Franklin County CARES. I'll let you know a little bit of the background of where this data is coming from. They have our Claritas Pop Facts demographics module. So here we have 500 data variables, and these are updated annually with data for the state, county, Franklin County, I'll show you here, the Franklin County Public Health Service area, zip codes as you scroll down, and then even into census tracts. So this is a private data source providing these annual estimates to the current year. As you can see, we have 2026 data, and they're based on validated national sources, including the Census and American Community Survey. So we've got a lot of really rich to the year data here that can give us that background of the basis of who we're working with in the community. The summary page here, where we begin, gives you the highlights of each section. So you can see them across the top, population to employment. And then as we scroll, I'll just pause on one of these so you can see a little more of what we get here. So population by race and ethnicity. This is the overview, but we'll take a deeper dive in just a second. But as you can see, each of these graphics, so if we look in the top right corner, is downloadable. So we can pull it to pop into maybe an OD2A report, check-in, or reapplication. And this is available, publicly available for anybody to download to see those, take this quick visual with you as well. And so now let's take a little bit of a look. If we were to click on see more race ethnicity data, I have it already loaded over here. You can see the top of the page. We have a lot of breakdowns here by race or ethnicity or both, and then by things from sex to, so breakdowns of race, ethnicity, and sex, to age, to educational attainment. Let's take a look down to Hispanic and Latino population by, where was it? By specific origin. So we can see even as specific for Hispanic and Asian folks where they've said they're coming from. So we can get down to get to really know our community and better understand who we're working with, and how we really find those key community members to make our work more impactful, so we understand first better who we're working with, and then we can move from there with that baseline of these demographics. So we like to start with the demographics before we go a little deeper, like I said, to take that baseline of understanding, but also we'll take a look now at a little bit more of general data that's available on CARES. So the next place I have, I'll show you from the navigation bar, we have these community profiles. And so Logan and her team have done a really phenomenal job of pulling together all of these communities that people will immediately recognize, where you live, where you work, where you play, where you go to the grocery. You know these names. So this makes the data a lot more accessible as an entry point. And so we'll take a first look at Bexley. So these also are just a quick snapshot in this dashboard. We have an introduction on each of these pages to give you an understanding of what we're looking at, and then just one indicator at a time. So we have this drop-down menu here. These are featured by census place. So these are the census place names. And like I said, people can recognize that, but then they can also see these comparisons immediately to understand. So adults 65 plus with hearing difficulty, they're alphabetical, so that's what comes first. We can see that value. It'll always default to the most recent period of measure. So 2020 through 2024 here. And then these comparisons that give it that bigger context. So these are blue because it's not necessarily good or bad. We're not putting a goal on reducing hearing difficulty necessarily here. But we can see that 11.2% is higher than the overall county value. So we have that arrow up right there. And then related to the Ohio and US value, we're actually a little bit lower. So 2% lower than the Ohio value, a little bit more than the US value. And then that trend over time, we can see if we have at least 4 data points, we can see which way we're headed. So headed down here, so that's good in the big scheme of things. And then like any dashboard on the platform, whether we have one indicator or a full list, we also have this card view up top. So here, again, thinking about grant reporting or sharing with stakeholders, getting that quick snapshot, we have these cards that you can actually click Save Card on, and it'll download it as an image that you can pop into a report or presentation and get this quick snapshot for folks who would be interested to share. And then, so as we see, as I mentioned, these comparisons over here, we also have a legend to the side. So you can see if you forget, okay, well that arrow's up, but why is it blue? This will tell you over here. So it's a neutral value in this instance. So we're not saying it's necessarily better or worse. But if we have some that are connected to things that we want to be better or worse, they'll be red or green over here. And then next, we will take a peek over to a little more specific pages, getting a little more in depth. So here we have, to the theme of CARES, overdose deaths among Franklin County residents. And this we have linked in the local data on substance use. So overdose deaths, this is what we're talking about today, but you can also see all of the options of these embedded Tableau dashboards on the HCI platform, which makes it a lot more streamlined when, as Logan has shared, they're updating data really frequently. And they already have an internal system, so we're able to just embed this directly into the platform. So you can see as we hover, it's interactive. These overdose deaths page showcases this as a key way to prevent recreating the wheel, really, when you're already working on this, and it can be interactive and visualized here. So we have a little bit more about the most recent data here through 2025 down below, but I'll pass it to Logan to share a little more about these actual data that we're seeing here. So I want to share a little bit. Logan.
So that top bar is just our yearly count. You can that 2020 timeframe that I mentioned, where we peaked with 803 deaths, and that steady decline that we've continued to see since then, with that biggest drop happening between 23 and 24. But we know that counts don't always paint the best picture, and that we really need to look at the overdose death rates. And so that's what that trend line is at the bottom. So currently it's set to all Franklin County residents, but it is able to be filtered by sex, race, ethnicities, and then male and female breakouts by race, ethnicity, because we do just see such a difference between all of our different ethnic groups, and especially among our non-Hispanic Black residents compared to our non-Hispanic white residents. We wanted to make sure that the public could easily find that data as well.
Yeah, so you can see I clicked on rate by sex, so you can see that breakout and see how those are really different when we get down into that more granular data. You were a little quiet at the start, Logan, but I think we got you. You were talking about the counts at first. Sorry.
Yes. Yeah, I was counting, yep, the bar graph at the top. So
yeah, perfect. We also have interactivity going through. We can take a look through different ways in which the overdose data are presented. Like we saw with the demographics, we can get a little deeper. Right now we're looking by race, ethnicity on the side, but also by sex. So this is really awesome to be able to see this data, like we mentioned before, from the coroner's office, in action and accessible. So great work to your team.
Thank you. Yeah.
Yeah. So we've gotten a baseline of the demographics of the county, taken a little bit of a deeper dive into this data topic, really what CARES is built out on. But on the last part of the data focus, I also want to show a quick takeaway tool that we have on the platform. So I'll take you to this next page I have open already. But we have up here under See How We Compare, we have the Socio Needs Index Suite, and then 3 indices that we've built out, we as in Conduent HCI, that are automatically included on the platform that give you a quick snapshot of 3 different key areas that we know a lot of folks in public health are focusing on. So I'll show you here. You can see them all 3 listed. We have the mental health index open, and it's a measure of socioeconomic and health factors correlated with self-reported poor mental health. But we also have our food insecurity index related to food access. So similarly there, similar tool, just different indicators that go into it. And then our community health index, which is focused on social determinants of health and how they relate to preventable hospitalizations and preventable deaths or premature death. But we'll take a look here since we're on the topic of behavioral health overall. Our mental health index, as I said, is, we can see even here, don't have to listen if you like to read even more. It's a measure of socioeconomic and health factors in relation to self-reported poor mental health. This is showing a quick snapshot of how we are compared both nationally and within the county. This is, I'll show you before we take too deep of a dive. If we click on the How Does It Work little button over here, you can actually see what those validated indicators that go into the index when we build out these index values. It includes access to care, so we can see these, physical health status, transportation, employment, and household environment, which our data team annually calculates and pulls these together to build out these index values. So I'll show you in action on the map as well. If you want to learn more, if you're taking a tour of this platform, you can also click here to learn more about the mental health index, and that'll take you to more articles about the methodology and how we've built out these indices. But let's take a look in the actual map. So when you see I'm hovering over this zip code 43219, and we have our 2026 values. So these values have been updated through this year. This includes Claritas data, so like what we saw from the demographics. We also get some other key indicators, as we saw in the how does it work pop out. And that value is 94.1. So that is showing us a value from 0 of the lowest need to 100, the highest need, in comparison to all zip codes across the country. This provides that larger national context on really understanding what our communities are experiencing. And then the shading, so as we see the bottom left corner and then also in the map itself, that gives us the more local context. So 94.1 is high, period, either way, that's very close to 100. But we can also see throughout the county, it's shaded dark, so that is our higher area. But we can see we actually get a little bit higher as we get into some of these other values, maybe a little more into the urban area of Columbus, which often unfortunately makes sense sometimes with these economic factors related to mental health. And so, like I said, we have that comparison locally. We can see maybe the lowest one. If you can see a little bit as I highlight, it'll show up on the map as well, or from the map we'll highlight on the data table below. So we can see we're ranging from 17.6, looks like that's our lowest value here, all the way up to that 98.8 value. So we've got a really wide expanse of how folks are experiencing potential issues with mental health and other factors that we know can relate to mental health. And something like this as a quick snapshot, so it's not just one indicator at a time, we can see that quick understanding, and on a map where we know where we live, we know what these highways are and really where you're working, we can better hone in where we're supporting, building out, creating new programs, or really supporting programs already in place to get the most impact. So I know in public health, we have limited resources across the board. That's everywhere, unfortunately. And so here, when we're thinking about behavioral health and how folks might be experiencing access to what they need, a lack thereof, or an abundance, we can see how this plays out on the map related to this quick index snapshot. So thinking about equitable distribution of resources, this can really help in addressing disparities geographically, at least. So when we see that highest value, clicking over here, we see it up top as well. We know that maybe based on this and then pulling in like community experience, those voices of community partners, of folks on the ground, can validate what we're seeing in the data and better hone in where we want to be in implementing programs. So thinking about that and thinking about getting partners involved, everything on this page is also downloadable like we saw in the other modules on the platform. So up in the top right corner, we can export this map. We can add on labels. It can get a little chaotic with the zip codes, but we could also change it to census tracts if you want to get even smaller into some of the, especially the urban areas, get some smaller census tracts. Or if we want to see that bigger comparison, so the county overall, we could get one large county value and see how we're doing across all counties to get that index value in comparison to the whole country. We can also change the background. So if you're taking this with you for a report, if you want to make it a little bit smoother, less filled in background, and then just download as you like from there. And then as we scroll, we also have, like we were seeing, that data table or the bar graph, sorry, interactive here, highlights what we see. And then top right corner, same thing. We can download it as an image, PDF, or if you want to pull it into an Excel document, you can download it as a CSV, put it in alongside other data, maybe to make it a little more, give more context. And then lastly, we have that full data table, as I was mentioning. So anytime we're hovering over any of these, it also hovers in the other graphics, as you can see up there. And this gives us options to rank them. So if we know our zip codes in order numerically, if anyone does that, we could rank them, or we could arrange them that way. But I think more often, either by the actual index value, we can see that there. But then also by population. I think this is really interesting when we have this pulls directly from those Claritas demographic data that we saw at the start of the demo part here. We can arrange by population and see, so even though this value is really low, it's not affecting a lot of people, these values get really high. We're seeing a few more people, but it's not at all the highest number of population. So maybe it's a combo when we're looking at this to better understand and better hone in where we're sending resources of, so this is a higher value, but also higher population. So maybe we'll be more impactful if we implement programs here. There are a lot of factors that can go into it, but this hopefully provides that quick snapshot to better understand several data factors when we're making decisions in public health programming. And then lastly, you can see the data source as mentioned. We calculate these using Claritas PopFacts data, also a couple of other sources from Claritas, including consumer profiles. And then, as mentioned before, so Claritas uses different sources. We also pull in the American Community Survey, and additionally for this one, CDC Places indicators for this. So, lastly, as we come through to kind of paint the bigger picture, let's take a hop over to out of the data and how we've seen Franklin County Cares provide that bigger support to the community. So we're talking about transparency of data, but also what about the folks who, okay, they're living it. What can they do to help get connected and really improve their own situation, or maybe community partners to connect folks to resources. So under tools and resources on the navigation bar, we have this recovery and support resources page that Logan and her team have built out. You can see that beautiful mural that's actually in community. So this is something that folks might recognize when they've been out and around, know the land. And we can see a variety of community resources for linkage to care. So I'll scroll down here and see these for a second. Harm reduction, we also see treatment, access to medical screenings, a variety of things. These are all linked, clickable to these partner organizations. And we can really link folks in directly to what is available in the community. And as we scroll, we also have through the overall county, so Franklin County has a partnership with Credible Mind. So we have this embedded of mental health and behavioral health resources directly embedded so that they can search through to see these resources, and it'll directly take you into that other tool. So this is a something that gets folks, so maybe they're not quite ready to take a full step into the world. This gets you a little bit of those more accessible things from online, something a little bit more lower barrier, maybe for finding stress, depression, different kinds of mental health related online resources here. This also connects you to local resources, but it can maybe give a little bit of a slower entry into different media types we see. So there's another support tool there. And then lastly, last couple of things to bring the data to life. This is a page that's more community facing, right? But we're still a data hub. We still want to have that understanding of where we are and what we're dealing with, we have another Tableau dashboard embedded here. And this features a tangible comparison to, you can see, the seats in the Ohio Stadium. So something that I would say most, if not all, Ohio folks will know about. Oops, clicked on it. But we can see, so in this range of time, we can see how many, for this one, admissions were for substance abuse, dependence, or substance use disorder. That is nearly half of the whole stadium, right? That's a lot. It says would fill 50%, so maybe right at 50% of the whole stadium. This is a really cool tool because you've got a variety of different admission options, and you can see that directly in a visualization that folks can kind of relate to and understand. And these data are slightly less technical with that more public-facing audience in mind, and are meant to offer support and understanding to folks seeking treatment, I would say. Really seeing that they're not alone in their experience, and to build on that understanding of what your community is experiencing. Then lastly, as we scroll, we also have a feature here. You can see it's look a little blown up, but they're normally smaller. But we have a scroll through of actual community testimonials. So building on the storytelling for solidarity, we have community testimonials from local support groups. So you can open up one of these to see that in action. So you can see that addiction crisis team, emergency addiction crisis team, showing more of people's experiences in action and how other folks are experiencing this in your own community. So these are really building out that full circle of using the data and then putting it into practice and supporting folks on the ground experiencing these issues. So now I'll hand it back to Logan and bring us back to the slides to discuss the outcomes that we've seen since launching Timely Overdose Death Data and Community Resources, as we see here on CARES. So I will relaunch this. There we go.
Thank you. So as you can see, in the end, CARES really did become a one-stop shop for all health-related data, substance use-related data, and resources for the community. Our biggest success has been reducing that lag time for overdose mortality data sharing, and the fact that our dashboard also visualizes that mortality data and our emergency department data, so community partners can easily understand which parts of the county might be experiencing higher rates of overdoses, so they know maybe where to go target their interventions. Additionally, by having several substance use data dashboards, we've been able to provide community members and partners a much better understanding of substance use trends in the county. We now, drug trends are constantly changing, and so being able to get this information out to our partners as quickly as possible has really been helpful on limiting the hospitalizations and deaths that might come with them. So additionally, FCPH really wanted to understand how partners are using this data that we have on CARES. So every year we meet with our grantees that we fund through the OD2A local grant to evaluate the progress in their work plans. And as part of this meeting, we really dive into questions around if partners are utilizing the CARES website. If so, what data they use most often, if they feel like there's any missing data, and then, of course, if there's any issues or barriers they've experienced with the site. Sometimes links break or a dashboard no longer shows up, and so it's just nice to know that they can let us know if something like that happens.
Yeah, this is great that you're not just using the hard numbers data, but also collecting data from experience, so we can continue that kind of cycle of iteration and making sure we're getting the best tools to folks to use.
And so as part of that meeting, one of our community partners, African American Male Wellness Agency, had said that this data allowed us to conduct an in-depth analysis of each zip code's demographics as outlined on the website. Additionally, we shared key insights on overdose trends and emergency visits from recent years, fostering community awareness. The website has been an essential tool in refining our prevention and education strategies, ultimately contributing to stigma reduction within the community. And so this is a partner that is really working their boots on the ground out on the streets of Columbus, working with the African American male population to address stigma around drug use, and not only drug use, but the harm reduction tools that come along with it. So educating them on naloxone, how to use naloxone, and making sure that everybody has naloxone who needs it. And so as part of this, they've been able to distribute some of the highest numbers of naloxone in their agency's history in the past couple years. So they've been really seeing a lot of great success, and I was just really appreciative of them shouting out CARES for that success as well.
Yeah, this is phenomenal. And thinking about, so you mentioned before, data tables, an Excel spreadsheet is not accessible to everyone, but also just not as interactive and understandable. So in this, the partner was talking about seeing the zip code's demographics so we can get down to zip code. And like we saw, for example, in the mental health index, we can see where folks are most affected and really directly pinpoint where we should start to look to go, right?
Yeah. And it helps because community members might not be in the mindset, or they are in the mindset of that doesn't happen in our neighborhood, or that's not an issue here. And so when you can show visually, like it is, and like this is where we see higher rates of overdoses, having that picture for them has been really insightful and building that communication gap.
Yeah, that's a great point there.
So, of course, this hasn't been without some challenges and barriers. And I think one of our main barriers has been maintaining long-term data sharing. Sometimes data sharing stops, whether it's due to staff turnover or other organizations being short-staffed. But also priorities change, and maybe they don't have the data and technical capacity anymore to share the data. Additionally, even though we ask for feedback at these yearly meetings, it's challenging to receive feedback that's actually actionable, that could be incorporated on the site. A lot of partners just say, nope, it's great. We have no issues with it, which is great to hear, but we wanted to continue to improve CARES as much as we can. And finally, managing our internal dashboards and improving our own processes to make updating these more efficient. This is a cumbersome process currently. We have 5 dashboards on the CARES website with 27 local indicators we're managing. And so making sure that we have our own processes in place to make sure everything's being updated as needed. Because sometimes things get lost in the weeds and something might not get updated as quickly as it should.
Definitely. We have a lot of respect for that. I think we might get some EPIs watching this and they'll understand. It's a big lift, but I think the impact is really powerful to see.
So some of our future goals include expanding the range of data indicators showcasing social determinants of poor behavioral health outcomes, including adverse childhood experiences and unmet healthcare needs. We actually just recently added some ACEs indicators a few months ago, so that data is now available for the public. And then we also want to continue to paint a wider reaching picture of the drivers of opioid misuse and overdose risk that can further support community action and partnership to help enable a more holistic approach to overdose prevention. And then we also plan on using the HCI platform story tool. So we didn't get to highlight that today, but it's a tool where you can really highlight some great work being done. And so we really want to highlight the work that Franklin County Public Health, but also that our partners are doing to address the substance use and overdoses in the county. And as you saw, we have data for the cities in Franklin County, but we have a lot of townships in our jurisdiction as well. And that data was not available. But currently we are in the process of getting roll-ups for each township, and they should be added to our site by the end of this year so that every jurisdiction in the county will have a data profile.
Well, that's really exciting to thinking about getting folks engaged. And as you're putting in ACEs data, so we might get folks from different sectors, getting things that are immediately recognizable to them so they know their township, you know what to look for. And I think that's the power of this being so we do have that focus on specific opioid misuse, overdose, deaths data, but there are a lot of other data already there. So if we've got those partners working in maternal and child health, looking at ACEs data, we already have indicators that are automatically uploaded on the platform. So that's not as big of a lift on y'all's end, at least, to get the buy-in. So yeah.
And so then as we start wrapping up, some of our key takeaways from this work include real-time mortality data real-time mortality data integration combined with the visualization and storytelling as a replicable step strategy for communities who are also seeking to accelerate their overdose prevention work. And we also really recommend leveraging technology platforms that offer interactive mapping and narrative tools, because that helps make that data more meaningful for communities, but also more actionable for the diverse communities that might be living in your own jurisdictions.
Awesome. Thank you so much for this, Logan. And we're excited to be that technology platform for y'all to make it more useful and understandable and interactive. So now I've gathered some questions from my perspective, from my teammates, from folks who aren't as integrated into this work. So I'm going to stop the share so we can see each other face to face in the recording. And I'll give you a couple of questions here to learn a little bit more about the process and everything that you've talked about so far. So first off, we talk about those cross-sector partnerships. Can you tell me more about how they were initiated?
Yeah, so when we knew overdoses were occurring, we could tell that hospitalizations were increasing through surveillance systems. We knew deaths were rising, and we had to take the step back and be like, well, who would be interacting with these people first? And so we knew our EMS and our police and our fire. And so that's where we really brought in the sheriff's office, the fire department to the table. We use the OD map tool, if people are familiar with that. So a lot of our EMS services feed into that. But they also have that shared interest of, this is a huge problem affecting our community. How can we help address it? And so bringing people to the table to share data at that time wasn't as hard as I think we might have anticipated. People really were buying in, and having the OD2A funding and it being so data focused really helped with that as well.
Yeah, absolutely. And that's the OD map. I know I've talked to some other folks across the country. That's a national resource, right?
Yes. Yep.
And those data, are they preliminary or are they publicly available at that point?
So my understanding is only the jurisdictions who have access to ODMAP have access to ODMAP, but then you can kind of reformat it and as needed to make it aggregate shareable data.
Yeah, de-anonymize. Yeah, I've definitely seen issues. I think that's with those partnerships, knowing they're working with that data that might not be able to be put out and visualized. That's really cool to get folks where you already know they're interested into this. Yeah. So we talked about that from the start, but what's kept folks engaged, those partners engaged over time? How have you all done that?
Yeah. Well, I think a huge part of that is because we've continued to have the OD2A grant. And so all of our work, it's literally data to action. So everything we do in the community is based on the data we're gathering. And we're very lucky to have partners that have understood the importance of that data. But unfortunately, not all partners have stayed engaged. We have lost some data sources. We had to archive our 911 calls dashboard just because we couldn't keep up the data sharing anymore. And so we know that priorities change and we just kind of adapt and flex where we can to replace with new data. But I think too, seeing the decreases that we have in our community and seeing the outcomes that we're having makes people feel good, and they are proud to be part of that work to continue showing up to the table and sharing their data. So
Absolutely. Yeah. So on that note, who do you see engaging with the data today? Who are we looking at?
Yes, we still have our fire department. We still get data from the Columbus fire. We still are using the state systems for epicenter, and obviously the coroner's office now is sending a lot more frequent data. But we've brought on treatment providers, which has been a huge, like that was a huge win in the last year, having two treatment providers being willing to share linkage and retention data with us. We've been able to build with our criminal justice partner to understand the MAT process in our county jails and how that's going and how many people are being treated for MAT while in jail and what happens once they exit jail. So we've brought in a lot of new partners in the last year and a half to kind of expand that data beyond just deaths and hospitalizations.
Yeah. Yeah. As we see the death rates going down, I think that's really important to understand what has changed, but also that folks aren't fully not experiencing it, even though they are living through opioid misuse disorder. Yeah. Cool. So on that too, kind of, have you seen interest in the opioid crisis overall change? And if so, how?
I feel like it kind of goes in two separate ways. You have people who continue to have that interest and knowing that despite the numbers going down, it's still a huge problem, especially in our community. And so they continue showing up when it's hard or and when resources are limited and they keep showing up for the clients that need them.
Yeah.
But then you also do have a crowd of people who kind of get used to the numbers of, oh, we're hearing about this again. Oh, we're still on this topic. And so I think we're very lucky in Franklin County to have a community that's so involved and passionate about this work that we've been able to maintain a lot of peaked interest despite the numbers going down.
Yeah. That's avoiding the fatigue is always a fun one with
Yeah,
any public health issue. But
yeah, that one's the hard one.
yeah. So let's talk about some of your wins. What kind of community actions have you seen the data influence?
Yeah, so as we saw from African American Male Wellness, they've been able to distribute the highest number of naloxone kits in their recent history, and so making sure that we're getting naloxone out to the people who need it most has been a huge win. We've also been able to incorporate our peers, so we have peers who have lived experience who work with individuals who are ready for recovery or ready to start working in the world of recovery, and being able to help inform some of their work has been really helpful. And then we also do a lot as an agency, data reports. And so, we've been able to really dig into some populations like the unsheltered community and share that data back out with partners who work with them. And so understanding those unique populations that maybe people aren't digging into as much has been beneficial, not for us, but also the actual community members, as they're being represented in the data now and at the forethought of our minds as we continue to work and replan our intervention strategies.
I love that. You're getting the interpersonal, the organizational level, community level, like wider spans. That's
Yeah.
awesome. That's very exciting.
Thank you.
To like see the different levels of the impact over these years. Okay, so last question. What are you most proud of with this work?
I think I'm really biased. I seeing the numbers drop, I started this work back in 2022 and it was still a huge, numbers were still very high. We were still seeing peak numbers. And so watching the numbers decrease and knowing that, the work that we're doing does have an impact in our communities. And despite what people might say, like every little step matters. And the stigma reduction that we've seen, people being open to accepting naloxone, is a lot of my pride. But also I'm just really proud of my team for all the data work that we do and that we are able to provide all this data to the community in such a quick turnaround with, we have 2026 fatality data on our dashboard. So people have an idea of what's even happening so far this year. And I think that is just really like helpful for us and them and everybody. So it's been nice.
That's huge. Yeah. Claps to that.
Thank you.
Yeah, just talking about it more, making things more accessible and open and naming what's happening is a multifaceted reduction of that stigma, and that's
Yeah.
awesome. Yay. Well, thank you so much, Logan, for sharing your expertise. Thanks to our viewers for joining us virtually today. And we really hope you've enjoyed this presentation, learned something, and maybe have something you can take back to your team to put into action. If you have questions, comments, or would like to discuss any of the presentation topics further, you can reach us at the email addresses on the screen. And actually, if you want to chat in person, I'll be at NACCHO360 in Louisville, Kentucky in July. And so you can find me at our Conduent HCI booth 216 in the exhibit hall. Please stop by at least to say hi, even if you don't have questions. Hopefully you saw it. But thanks so much for your time, and that will conclude our presentation for today.